How to break a fever. If you or someone you're caring for has a fever, follow these steps to break the fever. Take your temperature and assess your symptoms. If your temperature runs 100.4 degrees Fahrenheit 38 degrees Celsius or higher, you have a fever. Stay in bed and rest. Keep hydrated. Drinking water, iced tea, or very diluted juice to replenish fluids lost through sweating. But if keeping liquids down is difficult, suck on ice chips. Take over-the-counter medications like acetaminophen and ibuprofen to reduce fever. Note the proper dosage, and don't them use alongside other fever-reducing medications. You shouldn't give aspirin to your baby or child without consulting your doctor. Infants under 6 months of age shouldn't be given ibuprofen. Stay cool. Remove extra layers of clothing and blankets, unless you have the chills. Take tepid baths or using cold compresses to make you more comfortable. Cold baths, ice cube baths, or alcohol baths or rubs can be dangerous and should be avoided. But no matter what the number on the thermometer reads, if you have any concerns, consult your doctor. Running a fever is the body's response to fighting infections caused by viruses or bacteria. Fevers can also result from sunburn or from getting immunizations. Anyone can get a fever, regardless of age. People who have compromised immune systems may tend to have fevers more often than others do. To learn about specific treatment guidelines by age and understand your symptoms, continue reading. How to assess the situation. A healthy adult with a slight fever may feel like they've been hit with a Mack truck, but a baby with a high fever may sometimes feel pretty comfortable. The reverse of both scenarios can also occur. Fevers aren't one size fits all, and neither are their symptoms. Your overall comfort level and symptoms can help you decide how to treat a fever. If you have a fever, you may experience the following symptoms. Feeling weak or lightheaded, loss of appetite, headache, muscle aches, sweating, chills, nausea, vomiting, rash. If a rash accompanies your fever, you should consult with your doctor. It's important that your doctor determines the root cause of the rash. Other symptoms, such as nausea or vomiting, may resolve more quickly with medical attention. If your fever is over 103 degrees Fahrenheit 39.4 degrees Celsius, you should seek immediate medical attention. This is especially true if you're experiencing confusion, hallucinations, or convulsions. Temperature. Taking 101. Most people have a baseline temperature of 98.6 degrees Fahrenheit 37 degrees Celsius, although some people have a baseline that's slightly higher or lower. Daily temperature fluctuations are also normal. Different types of thermometers can yield different results. You're considered to be running a fever if an oral, rectal, ear, or temporal artery, forehead thermometer registers 100.4 degrees Fahrenheit 38 degrees Celsius or higher. If you use an axillary armpit thermometer, the temperature reading will be around 1 degree Fahrenheit or 1 degree Celsius lower, so anything over 99.4 degrees Fahrenheit 37 degrees Celsius would constitute a fever. Many pediatricians recommend using rectal thermometers for infants and babies. Discuss with your doctor which type of thermometer to use. You should also be sure to let them know what kind of thermometer you use to record your child's temperature. When to see a doctor. How and when you should treat a fever is generally determined by your age. If left untreated, fever can lead to serious complications in young children, older adults, and people with compromised immune systems. Infants and toddlers. Infants up to 3 months old should be seen by a doctor if they have a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or above. They should still see a doctor even if there are no other symptoms present. Babies 3 to 6 months old may not require treatment for fevers up to 102 degrees Fahrenheit 38.9 degrees Celsius. If your baby has other symptoms, or their fever goes above 102 degrees Fahrenheit 38.9 degrees Celsius, you should call your doctor. Children ages 6 months to 2 years old who have temperatures at or above 102 degrees Fahrenheit 38.9 degrees Celsius may take OTC medications under a doctor's supervision. Let your doctor know if the fever persists for more than a day, worsens, or doesn't come down with medication. Young children and adolescents. Children ages 2 to 17 years old generally don't need medication to reduce fevers under 102 degrees Fahrenheit 38.9 degrees Celsius. They may benefit from medication if they're experiencing symptoms such as irritability or muscle aches. If their fever goes above 102 degrees Fahrenheit 38.9 degrees Celsius, medication may be used to bring it down. If your child is very uncomfortable, or if their fever persists for more than 3 days, you should consult with your doctor. Adults 18 and over typically don't need medication for a fever under 102 degrees Fahrenheit 38.9 degrees Celsius. Fevers above that number may be reduced by medication. If your fever goes above 103 degrees Fahrenheit 39.4 degrees Celsius or doesn't respond to treatment, a call to the doctor is warranted. Adults with a fever and other symptoms, such as a stiff neck, severe pain anywhere in the body, or shortness of breath, should seek immediate medical attention. Fever in adults over age 65 doesn't automatically require special treatment, though you should be on the lookout for symptoms such as shortness of breath or confusion. If you're experiencing these symptoms, you should seek immediate medical support. You should also consult with your doctor if your fever goes above 102 degrees Fahrenheit 38.9 degrees Celsius or doesn't come down within 2 days. You can try OTC medications, but you should be sure they won't conflict with any other medications you're taking. Other guidelines: if you have a compromised immune system, you should seek a doctor's care. A compromised immune system is common in people that have HIV, cancer, or autoimmune diseases. Fever is often a sign of infection. Sometimes, these infections are fast-moving or hard to treat. So if you have a compromised immune system, getting immediate medical support for fever important. What you can do now: running a fever is usually nothing to worry about. It's important to understand the guidelines for treating fever, especially for young children, older adults, and people with a compromised immune system. If you or someone you're caring for has a fever, you should check the age guidelines. Is it safe to treat this fever at home, or should you see a doctor? Stay hydrated. Everyone can benefit from added electrolytes or water. Keep track of the duration. Regardless of your age, if your fever hasn't let up in about 2 days, you should seek medical attention. If you're ever unsure of how to handle a fever, call your doctor. They can work with you to determine the best course of action. Thanks for watching.